Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. My name is Herlinawati as the representative from our group. Today, I would like to present our article titled Knowledge, Attitude, Means, and Infrastructure BPJS, Healthcare and Society Security Agency Patient Referral. This article is written by Herlinawati from Public Health Department, Cirebon, Cucu Herawati from Public Health Department, Cirebon, Sri Lestari from Nursing Department, Cirebon, Rohmatul Hikmat from Nursing Department, Cirebon, Muslimin from Public Health Department, Cirebon, and Nur Arafah from Public Health Department, Cirebon. Introduction. Community Health Center is one organization which implements health policies. One of them is BPJS policy. One of the CHC implementation principles is referral principle. The referral system is organized with the aim of providing quality, effective, and efficient health service. However, if primary health facilities refer excessively, it will result in a build-up of patients in the hospital and will ultimately have an impact on declining quality of health services. Data derived from Mundu Community Health Center Unit in 2019 showed that the achievement of referrals was 16% and the standard is 15%. A preliminary survey showed that 5 of 8 patients said that the CHC was only used as a place to request referral. The respondents say that the reason for requesting a referral was due to no hospitalization at the CHC, and the health workers were less friendly and less communicative in providing explanations. Such problems could trigger referrals to more adequate facilities. The study used a quantitative approach with a cross-sectional study design. The populations in the study were BPJS patients in Mundu CHC unit, Cirebon district, as many as 15,005 people in 2019. Determination of the sample size used the solvent formula, which obtained a total sample of 99 respondents. The primary data were obtained through interviews, while the secondary data were obtained through documentation study. The instrument used in this study was a questionnaire. Univariate analysis used frequency distribution, and hypothesis test used the chi-square test. From this research, we can see the result as follows. 1. Relationship between patient's knowledge and referral. On this table, it showed that the majority of respondents, 85.7% with poor knowledge, were referred. Meanwhile, while the majority of respondents, 64.1% with good knowledge, were not referred. The result of the chi-square statistical test showed a p-value of 0.028, less than 0.05, which indicated that there was a significant relationship between the level of knowledge and BPJS patient referral. 2. Relationship between health workers' attitudes and referral. On this table, it showed that more than half respondents who stated that the health workers' attitudes were negative, 52.6%, were referred. Meanwhile, the majority of respondents, 78%, who stated that the health workers' attitude were positive, were not referred. The result of the chi-square statistical test showed that a p-value of 0.003, less than 0.05, which indicated that there was a significant relationship between the health workers' attitude and BPJS patient referral. 3. Relationship between infrastructure facilities and referral. On this table, it shows that the majority of respondents who stated that the infrastructure facilities at the CHC were incomplete, 70.6% were referred. Meanwhile, the majority of respondents who stated that the infrastructure facilities at CHC were complete, 76.9%, were not referred. The result of the chi-square statistical test showed a p-value of 0.000, less than 0.05, which indicated that there was a significant relationship between infrastructure facilities and BPJS patient referral. Discussion: Relationship between patient's knowledge and BPJS patient referral. The results show that there was a significant relationship between patient's knowledge and BPJS patient referral. The result of the study is in accordance with the opinion proposed by Leli Nurhidayah, 2017, that patients, as the people who use medical health services in health centers, need to have knowledge related to the implementation of referrals in order to control non-specialist referrals or unnecessary referrals by not using referrals at their own request. Relationship between health workers' attitudes and BPJS patient referral. The results showed that there was a significant relationship between the attitude of health workers and patient referral. The result of this study is in line with the evidence proposed by Lisa Lismaya 2014 through her study at the Gunung Sugi CHC that there was a relationship between the attitudes of health workers and outpatient referral. The lack of response of health workers who provide health services at the CHC became the reason for patients to request a referral letter and prefer to seek treatment at an advanced health facility, namely the hospital. Relationship between infrastructure and BPJS patient referral. The results show that there was a significant relationship between the availability of infrastructure facilities and patient referral. The result of this study is in line with the evidence proposed by Ernie Febrianti through her study in Makassar City that there was an effect of tool facilities on the implementation of outpatient referral. According to Shafruddin, good health services are health services that provide the necessary infrastructure facilities, such as the availability of tools to deal with the illness, as well as acceptable and sustainable drug requirements in the community. So, the conclusion is patients' knowledge, attitudes of health workers, and infrastructure facilities were several factors that caused the high referral of health services. Thus, some efforts are needed to increase the patient's knowledge so that they are more compliant with referral service standards, to improve the attitude of health workers and completeness of infrastructure facilities, as well as to conduct supervisions so that referral services are in accordance with established standards and mechanisms which can ultimately reduce patient referral rates. So, it's been an honor to be able to present our perspective before you all. Thank you and have a good day. Wassalamualaikum warahmatullahi wabarakatuh.